Hello. In this video, we will give some tips for the history-taking stations of the OSCE exam. This is specifically for the MRCEM exam, but it is also applicable to all OSCE exams. In history-taking stations, you will meet a patient or a role player who has a symptom or a complaint, and you should take a history from them. Of course, there are many different symptoms that can be presented by the patient or the role player. However, all history-taking stations can be similar, with small modifications for each symptom. So, you do not have to memorize specific items for each symptom. You can make history-taking stations very difficult and complicated if you try to memorize specific items for each symptom. And this is what most candidates do. Instead, you can memorize certain items that are applicable to all history-taking sessions. I will show you how. First of all, you will have 1 minute to read the scenario that will ask you to take the history from the patient and provide the patient with the suggested plan of management. In the scenario, you will be provided with the symptom of the patient and you should have in mind a differential diagnosis of this symptom. This differential diagnosis will be used mainly in the analysis of the presenting complaint. But you should know that the analysis of the presenting complaint is only one item of many other items of the history taking. It is the only item that can be different from a presenting complaint to another. But other items can be the same. So, if you spend all your time of studying history taking in memorizing the different items of the different presenting complaints, you will be wasting your time in preparing for getting only a few points of the history taking station. On the other hand, if you spend all your time of studying history taking in memorizing the other items that are similar in all history taking stations, you can pass these stations easily even if you do not analyze the presenting complaint perfectly. You may only ask the patient an open question about the presenting complaint, such as "Please let me know more about your symptom." Then you can ask some other questions according to their reply, trying to understand the presenting complaint. However, I will give you some general items that can be applied to all presenting complaints. What I want to say is that you can use certain items for all history-taking stations, and you do not have to study the history taking for each symptom as if it is a separate subject. So, you will start with the steps that should be done with all types of stations, not only the history taking stations. Those steps are as follows. Read the question outside. Knock the door and enter the room. Greet the people in the room. Wash your hand. Introduce yourself. Confirm patient identity and age. Ask the patient if they are comfortable or in pain and offer an analgesic if needed. Those steps should be done in nearly all types of stations. Of course, some steps are not applicable to some stations. You will discover this yourself. For example, if there is a station of CPR, then you will not greet the patient or confirm their identity. When you read the scenario and the questions, you should know clearly what is required from you in the station. For history-taking stations, you should find a scenario about a patient, and you should be asked to take a history from the patient and then explain your management plan to them. For example, Mrs. Taylor is a 68-year-old lady who is complaining of chest pain. Take a history and explain a management plan to her. After 1 minute, you should enter the room to perform what is asked of you within 7 minutes. So, you should be careful not to waste time or spend too much time on one point. You should enter the room, greet the examiner and the patient. In some other types of stations, you will find more people. So, in this case, you should greet the examiner, the patient, and any other people in the room according to the type of the station, as we will know in other videos. Then, you should wash your hands. Use alcohol sanitizer to wash your hands. Then, you should go to the patient, introduce yourself, and confirm their name and age. For example, you may say, "Good morning, I am Dr. Michael, emergency medicine physician. Please tell me your name and your age." Then, ask the patient if they are comfortable or in pain and offer an analgesic if needed. You should say, for example, "Are you comfortable or do you need a painkiller?" Again, the previous steps should be done nearly in all stations, where applicable, not only history-taking stations. Before we continue to the items of the history-taking stations, I would like to give you some general tips. The first tip: In history-taking stations, and all stations that involve communication, listen carefully to the patient and formulate your questions and responses according to what the patient is saying. Do not focus on memorizing and remembering questions and saying them regardless to what the patient is saying. For example, in the analysis of chest pain, you should ask the patient about where the pain is referred. But the patient may start by telling you that they have chest pain and tell you the site of referral. So, here you shouldn't ask about the site of referral again. Instead, you can confirm this by saying to the patient, "So, you have a chest pain that is referred to the right shoulder, okay?" So, try to be flexible and not ask questions regardless of the responses of the patient. Another tip. Expect unusual questions from the patient. And you should answer these questions clearly. So, it is not only about memorizing the items of the station and performing them in order. The patient may change the direction of the station. So, again, try to be flexible. Now, let's continue to the items of the history-taking station. You have read the question outside, entered the room, greeted people, washed your hand, introduced yourself, and confirmed the name and the age of the patient. Now, you should start taking history, fulfilling the following items. Establish the presenting complaint. Analyze the presenting complaint. Take past history. Take medications history. Take allergies history. Take social history. Take family history. Take sexual history and gynecological history. These are the items of the history itself. We will stop here to talk more about each item. Then we will move to the next part, which is explaining the management plan to the patient. First, you should establish the presenting complaint. You should have known the complaint from the scenario outside. So, you can ask the patient, for example, "I have known that you have chest pain, is it right?" Or you may ask the patient directly, "How can I help you?" Or "What is your complaint?" After the patient tells you the complaint, you should analyze the complaint. And this is the part that may be slightly different in the different history-taking stations. However, you can use similar items for all complaints. For the analysis of any presenting complaint, you should first ask the patient to talk more about their complaint. For example, "Please let me know more about your complaint. Please tell me everything." And you should let the patient talk without interruption, and listen carefully. Then, you should ask the patient about the following items. Description of the symptom, the onset, the course, the duration, the associated symptoms. These items are applicable to all presenting complaints, and some extra items may be needed for specific complaints. And each one of these items is linked to another item. Let's say how. In the description of the symptom, try to complete the story of the symptom by trying to know the data that are missed when told you more about the complaint. This means the exact site and the character or the nature of the symptom. So, these are two items that are linked together. For example, for pain, you should ask, "Where is the pain exactly and where is it referred? What is the character of the pain? Is it sharp, aching or throbbing?" Also, for bleeding, "From where do you bleed? What is the character of the blood and bleeding? Is it bright red or dark? What is the amount?" Usually, you will find yourself asking these questions automatically, and the patient may tell you the answer without asking. I mean, once you ask the patient the first question that we mentioned, which, "How can I help you?" or "What is your complaint?" the patient normally may say, for example, "I have severe chest pain in this area which is compressing." Or they may say, "I noticed a small amount of bright red blood in stool." So, the patient may say the site and the nature of the symptom without asking directly. But even if they do not say this, you will find yourself wanting to ask about this. The onset means asking the question, how did the symptom start? Did it start suddenly or gradually? The onset is linked to another item, which is what the patient was doing when the symptom started. So, you should ask, how did it start? Did it start suddenly or gradually? What were you doing when it started? The course means asking the question, how did the symptom progress? Is it increasing, decreasing, or constant? The course is linked to another item, which is what increases and what decreases the symptom. So, you should ask, how did the symptom progress? Is it increasing, decreasing or constant? What increases it? What decreases it? The duration means, for how long the patient has the symptom. The duration is linked to another item, which is whether there were previous similar episodes of this condition. So, you should ask, for how long do you have this? Do you have similar episodes before this episode? If any, let me know more about these episodes. Then you should ask about the associated symptoms and try to analyze them rapidly. So, you should ask, do you have other symptoms? Let me know more about them. And you should ask closed-ended questions based on the differential diagnosis of the complaint of the patient. So, you should ask, for example, do you have vomiting? Do you have cough? Do you have shortness of breath? Etc. These are the items of the analysis of the presenting complaint, and these are applicable nearly to all complaints. And we have some tips for the analysis of the presenting complaint. This tip again. The analysis of the presenting complaint is one item of the history taking and not the whole thing of history taking. And just asking the patient to tell you more about their complaint and asking them some other questions trying to understand what is going with them may cover most of the items. Another tip. Do not expect to ask about the items in the order you want, because the patient may lead the conversation and mention a specific item at the beginning of the conversation that you are planning to ask about at the end. For example, you may want to ask about the associated symptoms at the end, but the patient may say this in the beginning. So, again, try to be flexible. Another tip. You should use open and closed-ended questions efficiently. Open-ended questions mean the questions in which you do not provide the patient with choices, such as what is the nature of your pain. Closed-ended questions mean the questions in which you provide the patient with choices, such as is your pain aching or throbbing. For each item, you should start with open-ended questions, then closed-ended questions. You should have a differential diagnosis in mind to guide your questions, especially the closed-ended questions. Now, you have established and analyzed the presenting complaint. Then, you should take the past history. So, you should ask the patient, do you have any ongoing medical problems? Do you have diabetes mellitus? Do you have high blood pressure? Do you have heart disease, liver disease, kidney disease, etc.? Did you have any surgeries before? Were you admitted to the hospital before? And you should explore any problem, if any, by asking, please let me know more about this. Then you should take the medication history. So, you should ask, are you taking any medications now? And you should explore any medications, if any, by asking, please let me know more about the medications that you are taking. Then you should take the allergies history. So, you should ask, do you have any allergies? And you should explore any allergies, if any, by asking, please let me know more about this allergy. Then you should take social and occupational history. So, you should ask, what is your job? What does exactly your job involve? With whom do you live? Do you have any problem doing your normal daily activities? Do you smoke, use alcohol, use drugs? Then you should take family history. So, you should ask, are there any diseases that go in your family? Then you should take sexual and gynecological history. So, you should ask, are you sexually active? How many partners do you have? Are you practicing safe sex? Did you or your partner have any sexually transmitted diseases? When was the last menstrual cycle? Do you use contraceptive pills or any other means of contraception? Did you get pregnant before? How many times? Normal deliveries or cesarean sections? Any abortions, etc. Now, we have finished this section of establishing the presenting complaint, analyzing it, and taking the different histories. Before we continue, let's say what you have done till now. You have read the question outside in 1 minute, entered the room, greeted people, washed your hand, introduced yourself, confirmed the name and the age of the patient, established the presenting complaint, analyzed the presenting complaint, and took past, medications, allergies, social, family, and sexual histories. Now, Let's continue to the next section, which consists of the following items. Address patient worries. Summarize. Explain the plan of management. Confirm that the patient understands. Ask if the patient has any questions or concerns. You should address patient worries. So, you should ask them about their worries using a question such as, "What do you think about your condition?" And you should reply to the patient according to what they say to you or ask you. Then, you should summarize everything to the patient to confirm that you understand their complaints well. Then, you should explain to the patient the plan of management. You should tell the patient about the examinations, investigations, treatment, whether they should be admitted to the hospital or discharged. So, you may say, "Given your symptoms, we should examine you, do some investigations, provide you with treatment and discharge you home." And you should at least give some details of this. For example, "Given that you have chest pain, we should examine you and measure your vital signs. And we will perform an ECG to check your heart, and some other investigations. And we will give you some medications to protect your heart until we confirm the diagnosis. According to the confirmed diagnosis, we will decide if you should be admitted to the hospital or you can go home." Note that explaining the management plan is just one item among other items. So, you should not waste much time on it. Because if you talk about the management plan in detail, you may take a long time. So, just mention the plan in brief, then move to the next item. The next item is to confirm that the patient understands. So, you just ask the patient a question like, "Is that clear?" Then, you should ask the patient if they have any questions or concerns by asking the patient simply, "Do you have any questions or concerns?" And you should respond to the patient according to their questions. And also you should confirm that the patient understands by asking frequently, "Is that clear?" So, in this section, you have addressed patient worries, summarized the history to the patient, explained the plan of management, confirmed that the patient understands the plan, and asked if the patient has any questions or concerns, and replied them. Now, you have finished the station. Finish the station by thanking the patient and the examiner. Let me tell you what you have done and said using an example. Let's begin a station. You will have 1 minute to read the following question. Mr. John is a 49-year-old presenting with back pain. Take a detailed history regarding the back pain and explain to him a management plan. Read the question outside within 1 minute. Knock the door and enter the room. Greet the people in the room. You say, "Good morning. Wash your hand. Introduce yourself." You say, "I am Dr. Michael, an emergency medicine physician." Confirm patient identity and age. You say, "Please tell me your name and your age." Ask the patient if they are comfortable or in pain and offer an analgesic if needed. You say, "Are you comfortable or do you need a painkiller?" Establish the presenting complaint. You say, "How can I help you? What is your complaint?" Analyze the presenting complaint. First, you say, "Please let me know more about the pain. Let me know all about it." Ask the patient for the description of the pain, the sites and the character. You say, "Where is the pain exactly and where is it referred? What is the character of the pain? Is it sharp, aching, or throbbing?" Ask about the onset and the related item. You say, "How did the pain start? Did it start suddenly or gradually? What were you doing when it started?" Ask about the course and the related item. You say, "How did the pain progress? Is it increasing, decreasing, or constant? What increases it? What decreases it? Is it more severe in the morning? Does it increase or decrease with movement?" Ask about the duration and the related item. You say, "For how long do you have this pain? Did you have similar episodes before this episode? If any, let me know more about these episodes." Ask about the associated symptoms. You say, "Do you have other symptoms? Let me know more about them. Do you have limb weakness? Do you have limb numbness? Do you have problems with defecation or urination? Etc." Take past history. You say, "Do you have any ongoing medical problems? Do you have diabetes mellitus? Do you have high blood pressure? Do you have heart disease, liver disease, kidney disease, etc. Did you have any surgeries before? Were you admitted to the hospital before? Please let me know more about this. Take medications history. You say, are you taking any medications now? Please let me know more about the medications that you are taking. Take allergies history. You say, do you have any allergies? Please let me know more about this allergy. Take social history. You say, so, you should ask, what is your job? What does exactly your job involve? With whom do you live? Do you have any problem doing your normal daily activities? Do you smoke, use alcohol, use drugs? Take family history. You say, are there any diseases that go in your family? Take sexual history and gynecological history. You say, are you sexually active? How many partners do you have? Are you practicing safe sex? Did you or your partner have any sexually transmitted diseases? When was the last menstrual cycle? Do you use contraceptive pills or any other means of contraception? Did you get pregnant before? How many times? Normal deliveries or cesarean sections? Any abortions? Etc. Address patient worries. You say, what do you think about your condition? Summarize. You should say all the positive data that are mentioned by the patient. You say, so, you have back pain that started gradually and is increasing with time. And it is more severe in the morning. And continue to summarize the whole history. Explain the plan of management. You say, given your symptoms, we should examine you, do some investigations, provide you with treatment and discharge you home. And you should follow up in the rheumatology clinic. You should talk a little bit more about the details of the management according to the most probable diagnosis, which depends on the responses of the patient. Confirm that the patient understands. You say, is that clear? Ask if the patient has any questions or concerns. You say, do you have any questions or concerns? Finish the station by thanking the patient and the examiner. I will give other examples in other videos and apply these steps to most of the history-taking stations that may you encounter in the exam. But now I will give you some tips for the different history-taking stations. And let's start with a very important type of history-taking stations, which is the history-taking for pediatric presenting complaints. You may be asked to take a history from a mother or a father of a baby or a child who has or had a certain symptom. You should use the same items, nearly modifying them to be suitable for pediatric patients. You will know the modifications yourself. For example, you should not ask about sexual history with children. But the most important modification with pediatrics is asking about antenatal history, birth history, and developmental history. Or we can say you should ask about birth, what is before birth, and what is after birth. Antenatal history means pregnancy, so you should ask if there were any problems during pregnancy. For birth history, you should ask about the type of delivery, vaginal delivery, or cesarean section. You should also ask about any problems that occurred during delivery. For developmental history, you should ask if there were any problems that occurred during the development of the child. Also, as about the feeding history, if the baby is fed by breast or bottle, and ask about the immunization status. Let's take an example for pediatric history taking. You will have 1 minute to read the following question. Mark is a 4-year-old boy who has been brought in by paramedics following a seizure at home. The seizure self-terminated. Take a history from his mother and make a management plan. Read the question outside within 1 minute. Knock the door and enter the room. Greet the people in the room. You say, good morning. Wash your hand. Introduce yourself. You say, I am Dr. Michael, an emergency medicine physician. Confirm the name of the mother. You say, please tell me your name. Establish the presenting complaint. You say, how can I help you? The mother would tell you the complaint of her child. You should also confirm the name and the age of the child. You say, please tell me his name and his age. Analyze the presenting complaint. First, you say, please tell me all about what happened. Ask the patient for the description of the convulsions that occurred. You say, describe the convulsions exactly for me. Ask about the onset and the related item. You say, how did the convulsions start? What was the child doing when it started? Ask about the course and the related item. You say, how did the convulsions progress? What caused it to stop? Ask about the duration and the related item. You say, for how long did the seizure continue? Did the child have similar episodes before this episode? If any, please let me know more about these episodes. Ask about the associated symptoms. You say, does he have other symptoms? Let me know more about them. Did any other symptoms occur during the convulsions? And after the convulsions, such as loss of consciousness, urine, or stool incontinence, etc. Take antenatal history. You say, did any problems occur while you were pregnant with him? Take birth history. You say, did you deliver him by normal delivery or cesarean section? Did any problems occur during birth? Take developmental history. You say, did any problems occur after birth or during his development? Ask about feeding. You say, does he feed by breastfeeding or by bottle? Ask about immunizations. You say, did he get all of his immunizations? Take past history. You say, does he have any ongoing or previous medical problem? Did he have any surgeries before? Was he admitted to the hospital before? Please let me know more about this. Take medications history. You say, is he taking any medications now? Please let me know more about the medications that he is taking. Take allergies history. You say, does he have any allergies? Please let me know more about this allergy. Take family history. You say, are there any diseases that go in your family or the family of the father of the child? Address mother's worries. You say, what do you think about the condition of your child? Summarize. You should say all the positive data that are mentioned by the patient. You say, so, your child has febrile convulsions, and continue to summarize the whole history. Explain the plan of management. You say, we should examine your child, do some investigations, provide him with treatment for his fever and discharge him home. You should talk a little bit more about the details of febrile convulsions. Confirm that the mother understands. You say, is that clear? Ask if the mother has any questions or concerns. You say, do you have any questions or concerns? Finish the station by thanking the mother and the examiner. Now, let's move to another history-taking station that is a little bit different, which is sexual history-taking station. Of course, in all history-taking stations, you take sexual history, as we mentioned. But here we mean that the complaint of the patient is a sexual complaint. So, you may have the following questions. Mrs. Mary is a 35-year-old woman. She said that she needs to be seen because of a personal problem. Take a history from her and explain your management plan to her. Here there are some modifications. After finishing the initial items, you should offer to meet the patient in a private room. You should also assure the patient that the conversation is confidential. These are the two modifications in the first items. After asking the patient, how can I help you? The patient should tell you that she had sex with another person and she has some concerns. Now, you should do an analysis of the complaint with items that are different from the items of the analysis of other complaints. So, the main modifications in sexual history are in the analysis of the presenting complaint. You should first encourage the patient to tell you what happened. Please let me know more about what happened. Then, you should ask about the following items. With whom did you have sex? From where is the person? What type of sexual acts did you have? Penetrative, vaginal, oral, anal? Was it protected sex? Used a condom? Do you know him? And do you know his medical history and if he has any sexually transmitted diseases? Then, you should continue taking other histories as usual. Of course, in the management plan, you should mention the potential infection and that the patient should follow up with the genitourinary clinic. Now, I will give you some other tips. Another tip. You can classify history-taking stations into groups. For example, pediatric stations include apparent life-threatening events, febrile convulsions, limping child, etc. Pain stations include chest pain, abdominal pain, back pain, headaches, etc. Fall stations include fall, syncope, convulsions, etc. Bleeding stations include upper GIT bleeding, rectal bleeding, hematemesis, epistaxis, etc. This may help you if you want to memorize the items of analyzing the presenting complaint for each type of history-taking stations. The last tip. Use these general items of the history-taking and practice with the different types of the presenting complaints. For each presenting complaint, focus on knowing the differential diagnosis. This is the most helpful thing that will help you in the part of analyzing the presenting complaint. So, know the differential diagnoses, then practice and practice and practice. Finally, there are many sources that can help you to evaluate your practice. You can use the book of MRCEM Part C, 125 OSCE stations. And you can use geeky videos. Or you can use any other source that you find helpful. Thank you and see you in the next video.